Good afternoon, everybody. This is Betsy Wurzel, host of Chatting with Betsy on Passionate World Talk Radio. Jeanne White is the producer and writes the blog, so please read the blog because it has a lot of important information. Folks, get your pen, get your paper, because Sue Fernandez is coming on, and she has a wealth of information, updates on nursing homes and Medicare. So if I were you, get that paper and pen, because here comes Sue Fernandez. Thanks for coming on, Sue.
Thank you for the invitation, Betsy. What's cooking, good looking?
Oh, I'm just chilling here in New Jersey.
Good for you. Good for you.
I can't wait to hear about your news, and I want to thank you for coming on and always sharing your wealth of information. And I suggest for listeners to pay close attention. You can hear this audiocast again, but really get your cup of coffee or whatever ready, because Sue is going to spill what she knows.
Thank you, Betsy.
Go ahead. You're welcome. Go ahead, Sue. Mm-hmm.
Sure. If you recall, a couple of weeks ago I mentioned the different states awarding immunity, and this is a follow-up in reference to that, and I found some very good information, and I wanted to share with our listeners. Every Friday, the Center for Medicare and Medicaid Services holds a webinar series called COVID-19 Advocates for Nursing Home Residents. They provide an update on both state and national levels. Their webinars include staff from CMS and other advocacy organizations. Know that this information is partial, and if you're interested in listening to the full webinar, you can go on to CMS and Canner, CANHR, for more information. Due to this global pandemic, Medicare health insurance is making changes daily. And I ask that your listeners please understand the information, most of the information I give you is not or will not be pertaining to your state. So you have to understand and do your own research regarding your laws in your state. Betsy, while reading and listening to these webinars from CMS, I learned quite a bit, and I wanted to share my findings. I know a lot
Thank you.
Sure. A lot of caregivers are having problems visiting their loved ones in facilities. Now, I didn't know about this until last week. Obviously, that was on one of the webinars. Have you ever heard the term compassionate care?
Yes.
Betsy, what that is, it's a special situation if you want to see your loved one. A lot of times it refers to end-of-life situations, but not always. So I asked your caregivers, worst comes to worst, and I think they are kind of loosening up, talk to your facility and ask them if you could have a compassionate care visit with your loved one. It's my understanding, though, it depends on the facility, and that list is very narrow. But you may want to give it a try. You may or may not be able to see your loved one. Like I said, most of the times it's for end-of-life situations. But again, these facilities are loosening up, and they're creating different ways to visit with your loved one. Another significant move, CMS was waiving the 3-day hospitalization requirement, also known as observation status, for persons to receive their skilled nursing facility benefit. Again, I spoke about this on an earlier podcast, and I asked your listeners to please Google observation status so they know what I'm talking about, observation status. It says the announcement notes waiving the requirement for a 3-day prior hospitalization for coverage of a skilled nursing facility stay provides temporary emergency coverage of skilled nursing services without a qualifying hospital stay for those people who need to be transferred as a result of the effect of a disaster or emergency. So apparently what they're saying is because of this pandemic, they're not doing a 3-day inpatient or observation. Either way, they're allowing you to go to a hospital because of this emergency situation. And you won't have to pay the fees. Again, if you go into the hospital and you're there, normally you have to be noted as an inpatient patient for 3 full days, and if they send you to a facility, Medicare will pay for that skilled nursing facility. However, that's been waived. If you go in, whether you're an observation or whether you're inpatient, they're going to send you to a facility and they're going to waive that fee. So that's a good thing. They're hoping that they'll keep that as a permanent thing, but again, that particular rule is still under investigation and they're fighting about it. I did call Medicare, and they confirmed waiving the 3-day stay, also known as observation status, for everyone. This is not just for COVID-19 patients. So just so you know, there's that good news. In addition, I found out that Medicare has extended rehabilitation benefits to an additional 90 days during this pandemic. Another issue I spoke about a couple of weeks ago, Betsy, was the granting granting immunity for our skilled nursing facilities. Good news for California, and I called them last week also. They have not granted immunity for California. There are several other states that they have, but so far, knock on wood, they have not done that. On one of the webinars, Betsy, Canner staff attorney mentioned that there will be no evictions. And I immediately thought, when you say no evictions, if you're renting a house or even if you're buying a house, that they can't kick you out. But this also goes for nursing homes. The residents are considered tenants. There is an exception, though, and that's unless it involves health and safety issues. He also mentioned in California they have 2 what they call strike teams. One is they provide temporary CNA staff to assist medical staff, and 2, they offer consultants for assisting nursing homes. What Canner also mentioned was, in addition, he reported that the state recently issued a triage guide to all nursing home facilities. It's about rationing care to nursing home residents. He noted that nursing home residents will be the first to be sacrificed. The pediatric residents that have COVID-19 patients are given more consideration when it comes to visitation. That's not good news, but I just wanted to put it out there. Another issue, and if you recall, I mentioned there were several individuals on these webinars, and I listened to about 5 of them, Betsy, and there were all kinds of advocacy groups. There were ombudsmen from different states and things of that sort. So I'm going to talk about the state of Connecticut and what they reported on their update. Their ombudsman provided an update and reported that they are doing a Facebook Live between their 2 COVID-19 facilities and visually verifying its staff is at the facility. So, again, that's going to be on a Facebook Live program. They, too, have a strike plan, and they report staffing shortages. They also stated that the nursing facilities will be receiving a 15% increase across the board to help with extra added costs, plus $600 per day reimbursement. The ombudsman reported that their skilled nursing facilities must report to the public health department or a $5,000 fine will be awarded. That is for them. Basically, they're asking or telling them before they asked, and they weren't obliging. Now they're telling them, if you don't do a weekly report, we're going to fine your facility $5,000 a fine. It was also noted, Betsy, that a resident was denied additional rehabilitation Medicare benefits. The facility reported that since a resident had not improved, they were going to deny that resident Medicare. This is illegal, in which it violates the JIMO settlement agreement. Listeners, please advocate for your loved one. Learn what your Medicare health insurance offers. As I mentioned early, they are now extending it to 3-month rehabilitation services to your resident. So know that. And again, what the facility said was the fact that he was not improving. And they had taken this case to court because a lot of the facilities were denying Medicare benefits. So they took it to court. It was approved in 2013, and now they cannot use that excuse that your resident is not improving. Again, whether they're improving or not, it's just for them to continue service as much as possible. Now I'm going to speak in reference to Massachusetts. Advocacy, and they're called Manor. They reported that there were some transfers among skilled nursing facilities and families were not notified, which displayed a lack of transparency. Thankfully, on these transfers, they used only closed nursing homes. They do offer a phone number called Family Home Residential Line, which is open 9 to 5 daily. Their number is area code 617-660-5399. In addition, they have hour-long conference calls with Department of Public Health, Nursing and Residential Homes, and public, so you know this is open to the public. Michigan, the state ombudsman reported they have a long-standing relationship with Medicaid and do monthly coalition meetings with Olmsted. They also do weekly calls with the ombudsman for updates. They reported that some residents are stuck in limbo and that they have little to no PPE gear. Residents in hospital are being refused for admission. She also noted that it was imperative for advocates to tell their story, which is a key in advocating to state representatives. On part 4 of the series, Betsy, they discussed transferring of residents during the pandemic period, of which some rights have been waived. I didn't clearly understand this, but I ask that residents contact Medicare or a nonprofit organization that can advocate for you in reference to transferring. It's my understanding, and again, I'm not clear, it's my understanding that some of the facilities were moving COVID-19 patients to other facilities where they didn't have any COVID-19. And there's a lot of wrath about that and concern, which they should be concerned. Like I said, they discussed this on part 4 of the series regarding transferring residents. They also discussed residents to appeal. I don't fully understand this portion, but the listeners can go to either CMS or Canner websites. Apparently, the resident has limited rights, and some rights have been waived. On Series 4 of the COVID-19 Advocates for Nursing Home Residents, they discussed testing at skilled nursing facilities. It was reported that it was chaotic. Every state is different, and 9 states haven't started yet. Furthermore, they mentioned that there were limited testing supplies and that the federal mandate has left it up to the states. They're receiving help, additional help from the National Guard regarding testing. A couple of highlights, Betsy, for the upcoming HEROES Act, and it's not the law, so this is just what they're discussing. And again, you're welcome to go to the website and listen more about it. These are just some highlights. They are currently in the process of appointing a commissioner to oversee skilled nursing facilities. They're asking the facilities to designate COVID-19 facilities. Facilities are to report weekly to the Secretary of State, and they are waiving a 4-month requirement for CNAs. Now they're only asking for an 8-hour online class, and that these individuals must be competent. That scares me, Betsy, but...
It scares me too.
Right, but I think the issue is that there's a lack of staff for help in the facilities. Again, this is only during this pandemic situation. It's my understanding that most ombudsmen and state inspectors are not visiting any of the nursing homes due to the virus. Some ombudsmen are doing virtual appointments, but not all. Lastly, if you need to file a complaint, these are the procedures to take. Contact your local ombudsman and file a complaint. Then If that's not helping out, contact your local health department. They are going out to the facilities. Again, if that doesn't work, contact your local or state representative. Listeners and caregivers, you must advocate. When doing this, I highly recommend to be sure to document who you spoke to and what you discussed. Here are a few agencies that were on the webinars, Betsy, that I will share to your listeners.
Thank you.
Sure. So they're in different states and things of that sort. So let me offer you. One organization was called Justice in Aging. They are in Washington, D.C. Their phone number is 202-289-6976. And this organization, Justice in Aging, is also in Oakland in Los Angeles. Then again, you have the Centers for Medicare Advocacy. There, they have an office in Connecticut and Washington. Their number is 202-293-5760. There was another organization called Long-Term Care Community Coalition. They are with and collaborating with the New York Health Department. Their number is 212-664-7656. And lastly, CANNER, California Advocates for Nursing Home Residents. They're in San Francisco, and their number is area code 415-974-5171. Because of this pandemic, there are a lot of changes to Medicare health insurance. Please, listeners, call them. Like I mentioned, the two changes earlier with regards to observation status and an extra 90 days for rehabilitation. Medicare's number is 1-800-MEDICARE. They are open 24 hours a day, 7 days a week. Another thing I wanted to point out, Betsy, and you took this advice, was Livanta. They have a website. And what they are is Livanta is a beneficiary and family-centered care quality improvement organization. They are responsible for Medi-Cal case review, which support the rights of people on Medicare. These rights include protecting you when you get health care and making your health care services the laws say you can get. Livanta can help you even if you have a concern about the care you've been receiving or if you want to request a review, meaning an appeal, of your discharge from a healthcare facility. My suggestion, you file your complaint with Livanta prior to hospital charges. If not, ASAP. Their email address is, their website is livantaQIO.com. Their number is 877-588-1123, and they are free to all Medicare beneficiaries. That's it, Betsy.
Wow. Thank you so much, Sue, for doing your research and finding this out for our listeners. That is valuable information. The part where only 8 hours for training for an aide is scary because they're not being trained to deal with people who have dementia. I would think that would be separate training. So that's a little scary. And I have a question about Livanta with an appeal, Sue. Do you know by any chance how long does a person have to file a complaint or an appeal?
That's a good question. As I mentioned here earlier, file it prior to your loved one leaving the hospital. If you can. A lot of times you can't, but don't make it 2 weeks or a week. I have to look that up. You can look that up yourself, but they do want you to file as soon as possible. But I think the other thing is when you're in a hospital, because by the time they release you, Betsy, you can't do anything, whether they release you to a facility or to go home. They really can't do anything, and it's more difficult for them to do anything. As in, when they transfer a resident from one facility to the other, that's very difficult to get them back to their previous facility or to the hospital. So again, you have to file prior to discharge. And there'll be a lot of commotion. They'll get upset, but that's your right. That's what Livanta is there for. And they will review your case. And if I'm not mistaken, they have up to, I want to say, a day or two to get back with you. Most of the time, especially if you're in a facility, because that costs a lot of money because you're taking up a bed, right, Betsy? So they will put a lot of emphasis and attention to your case, to your appeal. Again, like I said, I think that'll get things going in the hospital. You know, I'm sure the social worker will talk to you, even the doctor will talk to you, but stand your ground if they're not getting sufficient care or if they want to release your loved one to home and you don't have enough care for them. That's not good. There's a lot of things that the advocate can speak up about prior this way, like I said, because once you get home, that's it. That's it. Unless it's in reference to health and it's out of your control. But either way, I ask listeners, please file a complaint ASAP. In addition, like I mentioned, document all your conversations, who you talked with, get their phone number, because you're going to be in the middle of a hurricane and you're going to be so upset you're not going to remember a lot of your conversations, what so-and-so promised, what so-and-so didn't promise, who they referred you to, what department they're going to. So, again, document, Betsy.
Yes, very important. And if you are in a crisis, I'll just use myself as an example because I can't think of another one. When my husband was passing away, I didn't call Livanta then. I did afterwards, probably a month afterwards.
Oh, really? Was that late? It was that late?
Yeah, oh, I believe it was.
Okay.
And I didn't know if they would accept that or not.
Right.
But that's why I had asked, because if somebody wants to file like a year later, I don't think they would take it a year later.
Right. But I think in your situation, and this is just me, I don't work for Livanta, but I'm thinking that if you filed within a month, that's good because you're grieving. It's not as if, you know, you just walked outside and you're filing a report for nothing. You're grieving. You lost your husband. So I think that probably fell into consideration with your case.
Yes, and they do get back. I will say this for Livanta, they were very nice. When I talked to them, they will get back to you. And I do want to just say here that this is where you have to have a will, because my experience was they didn't they state in the letter that if you're not the executor of the will, they really don't have to tell you information, because once the person has passed away, the power of attorney is not valid anymore. Okay. But she said that even though I was not
attorney. Oh, well, no, that's right. Sorry. I apologize.
Right.
I'm wrong. I'm sorry.
So I said, well, my husband didn't have a will. And she said, well, you know, you're the spouse, and as long as my name was on a, you know, as spouse on a death certificate, they would tell me the outcome of the investigation.
That's the other avenue that they use. That's great.
Yeah. So
that's a tip.
Yes, I highly recommend, even if your spouse or your parent, whoever it is that you have power of attorney of, get a will as soon as possible. And I think people should do that now anyway, whether you have an illness or not, and get a will and put your, you know, have your name down as executor so that you can obtain information if you have to do an appeal after a person passes away. You know, is this pleasant to talk about? No. But you know what, folks? It's reality. It's the truth. And here on Chatting with Betsy, I talk about the taboo, and I will pull the cover off and expose what needs to be said, because
Betsy,
that's how strongly I feel about it. Sure.
If I can interject for a second.
Mm-hmm.
I mentioned on another podcast that you don't have to go to an attorney. You can buy a will we have a store called Allard's. They have all kinds of office equipment and forms, and there's Home Depot. They too have form wills and powers of attorney. So there's no excuse to not have one, really, Betsy. Maybe have an advocate or someone help you fill it out, things of that sort, and it has to be filed with your local county. So go have that done ASAP. You don't have I shouldn't say you don't have to, but if you can't afford it, let me put it that way. If you can't afford it, go buy a pre-printed will at Office Depot. They have them there. Because if you go with an attorney's office, it's going to be quite a bit. The whole,
yes.
Depending where, and it depends where you live.
Yes. Yes, that's for sure. As a matter of fact, I don't mean to laugh, but I do have an appointment if they're opened in June. And the lawyer told me, because I want to update my will and get power of attorney of Josh, and have Josh do a will. And just a consultation is $395. So that's their charge an hour.
Wow,
and
for the consultation?
Yeah.
Is this a previous attorney, Betsy? Oh, okay.
I used him before, yes.
Right.
I have a situation where Josh is on Medicaid. He needs a special needs trust. So I want to make sure that he will be taken care of without getting screwed by the government. May not be nice to say, but it's true. I want him to be protected. So that's what I'm going to have to, spend the money on. And, I was thinking, even with
that's more details, Betsy.
That's
more, right.
So if you have a special needs child, no matter what age, start thinking about that. Is it pleasant to think about, folks? No, but you know what? It needs to be said up front. And, Sue and I, we shed the light on things that, it's not pleasant to talk about. Check your facility if your loved one is in a facility. Ask if they have compassionate care visits, especially if your loved one, is at the end of life. Speak up. Sue and I say this all the time. You have to be an advocate. And don't worry about appearing mean. Just be nice. Be firm, but you could be polite, because you catch more bees with honey, as the saying goes, or something like that. Be sweet, be polite, but you could be firm, and that's the ingredient. Sue, you're so full of information, valuable information. And I appreciate you coming on here and telling us. Now, I think that's great that they are waiving that 3-day observation. And if that becomes permanent, that would really be great, because a lot of people do not know about that when your loved one is in a hospital.
And on top of that, the hospitals were taking advantage of that rule in keeping the patients in observation. They would keep them there 2 weeks, and they would still be in observation. Not that there isn't a need for them to be in observation, but again, hospitals were abusing that rule. And again, the end result is if you're placed in a facility prior to those 3 days, you have to pay that facility. And the facilities run from about $8,000 to $12,000 per month in order for you to do rehab. So I don't know about you. I know I don't have. Most of the times the rehab's 2 to 3 months. I don't have $30,000 laying around that I could pay a facility, Betsy.
Me either. Wow. Good information to know. I was telling this to coworkers who were have parents in the Medicare age to know that. I even told my own mother when she went to the hospital in September that make sure it's a diagnosis, not an observation, in case you have to go to a facility. And my mom did end up going to a facility for a couple of weeks. So,
how long was she in the hospital for, Bets?
Oh, she had to be in the hospital for at least 3 weeks, or maybe a month, because she had open heart surgery, and she had complications.
That's right.
Yeah.
I remember now. Right.
So it's very, important. Even if you are, say, 65 years old, which would be 65 to be on Medicare unless you're disabled, and then you go to the hospital emergency room and then you get admitted, make sure it's a diagnosis.
Right, that it's your inpatient, that you're considered inpatient.
Inpatient, yes.
And they have to, Betsy, provide you a form. I don't have the name of it in front of me. Basically, that you understand that rule. So, and you have to ask questions. But again, like I said, when you're in the middle of an emergency, that's the last thing you want to do is read a whole manual on, discharge papers or becoming an inpatient. But either way, like I said, even right then and there, I'll be honest with you, if you have any issues, what it would do, and I hate to say it, but I'm going to say it anyways, is, file an appeal. If they're there for a couple of days and you need one more day, file an appeal. Sometimes it takes a day, sometimes it doesn't, but you can communicate with your doctor saying you're not receiving the services, things of that sort, and hopefully they'll be able to stay another day, and bingo, there's your 72 hours.
Very good information. I can't thank you enough, Sue. And listeners, you're going to want to hear this audio cast a few times to get this information. And you can catch my shows, Chatting with Betsy, on Spreaker, Spotify, iHeart, YouTube, Google, Apple, to name just a few. Look up Chatting with Betsy, subscribe, and you will get to hear the shows. This is a very informative show, and I would even go back to the previous show that Sue did on the information about nursing homes during this COVID crisis. This is important information that you can't hear enough of, really, Sue. I mean, it's just, They say the average person has to hear something 7 times until, the light bulb comes on. So if I had a loved one in the facility or a loved one at home that might need to be in a facility, I would definitely be listening to your information. I so appreciate you coming on. Is there anything else, Sue? How can people get in touch with you?
Obviously, on Facebook, you can PM me if you'd like. You can get a hold of me through Chatting with Betsy. Betsy, thank you very much. I appreciate it. And I also want to thank Jeanne White and Lillian Caldwell with Passionate World Talk Radio for allowing us to share this important information to caregivers.
You're welcome. Thank you again, Sue. And I want to remind the listeners, I can't believe tomorrow is June already. June is Brain and Alzheimer's Awareness Month. Not that caregivers need a month, because I know you don't. You live it every day. But for the public who aren't aware, start researching. Start looking into educating yourself, because nobody, and I will repeat, nobody is immune from any type of dementia or brain issue. So, think about that. And I just want to say kudos to all the caregivers, post and present. You're doing a great job. Thank you to our first responders. People in the world going crazy. Love up on each other. Be kind. We're all part of the human race. So, we're more alike than we are different. So show love to one another. This is Betsy Wurzel, host of Chatting with Betsy on Passionate World Talk Radio. Until we chat again, take care. Bye-bye now.